Okay, so a question came in about a blood glucose monitor, specifically kind of what the numbers mean. Because if you do get a blood glucose monitors from Levels or Stella, they're not going to diagnose and prescribe you. You kind of have to look at your own numbers and make a decision like, okay, how is this food affecting me, right? Because they take away liability since you're not a diabetic. So normally, at night, your numbers should go definitely below 100, ranging right around sometimes 75, 80. When you're in a fasting state, you will have those lower numbers. And then when you eat, a meal with carbohydrates in it, it could spike as, 30 points, but you can really see how food kind of spikes your blood glucose, right? And that's kind of what you're looking for, but you're also looking for your body to be able to deal with that spike, right? So you don't want your blood glucose up so high for so long, right? You want your body to respond to the glucose and be able to take it back down with insulin and its natural processes. So the question came in that said, that they're using the blood glucose monitor, and according to those, 70-85 is ideal with 15-point spike for non-carb meals and 30-point spike for meals with carbs. Mine hovers at 100 all the time until I eat. No carb meals are minimal spike, which makes sense, and carbs are real high, like up to 230 for something like an avocado roll, which I think those are wrapped with rice, if I can remember. I'm playing with that to help bring my baseline down. Any ideas? I'm doing a reset, just started a few days ago. Now, reset means a lot of things, so I would want to know what kind of foods the person is eating, or are they just, making sure to drink a lot of their Ninja Red. I'm thinking dill and coriander. So when you first get your blood glucose monitor, you really need to wear it for a couple of weeks, because one of the things that I found with them is they're not super accurate, meaning I could put one on and like if I had separate phones or something, one on this arm, one on that arm, and they might be 10 points off of each other, right? So there can be that. And I did find that sometimes, like I would, say I ranged at 85 normally, and then the next week, all of a sudden, like this one was closer to 95 or 100. So you want to make sure that you use enough of them to make sure, what your baselines really are, because is it really 100, or is it, have you used two sets of them and that makes sense? Or maybe it was just a little of that error that we're really looking at. So they're not 100% accurate. So you need to remember that all the time. The other thing that can cause our baselines to be higher is inflammation in the body, and particularly food sensitivity. So the person who wrote me this, I know they have a good amount of food sensitivities, and there could be low level inflammation happening like all the time. So that might cause more of maybe a little bit of insulin resistance, especially when you say I have an avocado roll and it goes up to 230. That might actually be telling you that is maybe you're sensitive to the rice, or maybe you're sensitive to, unfortunately, avocado or something like that. So you might want to take the foods out separately and see how your body responds. I know for me, like I was like, oh, I will go get a tropical smoothie, but I'll have avocado in it and I'll have protein, and when I have like just juice, or just like juices in my shake and things like that, I spike really high on my blood glucose monitor. So that's one thing that I had to figure out. But I did have a season too where I had been getting back into, getting off of my eating plan, getting into the sweets, having more carbs and stuff. And I did note, and through my hormone stuff, like having this craziness with my hormones, that I did elevate closer to that 100. And it was, obviously a period of about 2 weeks where I saw that too. So number one thing is make sure that you are not having any foods that you might be sensitive to. So take out the foods and look at that. Make sure you're eating. The best way to monitor it too is to have more of like 3 meals, or how many meals you're having with 3 to 4 hours in between. So you can look and say, okay, when I eat this food and then I go this many hours, this is what happens to, versus like just snacking, like letting it go down and then coming back up, right? So you can kind of see the patterns and see the foods. And then the next thing I would say to that is make sure, I would check into your hormones and stuff too if you're not seeing any changes with that as well. I even noticed things like lifting made a difference, and exercise, all of that. With those oils, like, could we use some food grade essential oils to help balance our blood sugar? Yeah, absolutely. And Acatea is one of the best ones that we have. Cinnamon bark, ninja shot is good. Dill and coriander have helped a lot of clients, like true diabetics and stuff too. So yeah, those are all good things. So hopefully this was helpful to that client and to any of you who are thinking about a blood glucose monitor. All right, bye-bye.